Now, as a former South Australian, I've got to tell you, I've not been in the habit of speaking up for Victoria. But what's going on now with closed borders and travel restrictions, now specifically targeting Victoria, has gone well beyond a joke. There were 60 new infections in Victoria today, 64 new infections over the last 24 hours. That's less than 10 for every million people. Yet now, because we've crushed infections in other states almost to nothing, the rest of the country is treating Victoria like a pariah, like a leper colony. Our politicians have changed the rules on us. They've changed the rationale for what they're doing in this country. The idea of our COVID-19 response was to make sure we slowed the spread of the virus sufficiently to protect our community and ensure our medical system was not overwhelmed. That was the plan, clearly enunciated. That's what our Prime Minister and the Premier said. That's what all the medical authorities argued. That was the medical advice. Well, we've exceeded ourselves in delivering on that. Yet now we have leaders who have decided their job is to prevent any infection. We have politicians who seem to think any infection is a slight against their state. That's despite the fact that 99% of all infections are minor. Only 1 in every 100 infections is serious. We've boosted our acute bed capabilities in this country threefold to 7,500 beds to cope with the pandemic. And as of today, only one of those beds is being used. We have 15 people in hospital and 1 person in an acute care bed, even though that we've provided 7,500 of them in preparation for the pandemic. That's how far we've crushed the infections compared to earlier fears. Yet now, states that needlessly closed their state borders months ago in a move that was always damaging to the economy and to national cohesion and quite possibly unconstitutional, well, now they're doubling down against Victoria. And have a look at this message from the South Australian Premier Stephen Marshall, making it very clear that Victorians will remain persona non grata. So much for the National Cabinet approach, and we're all in this together.
We are increasingly concerned about the outbreaks which are occurring in Victoria, and so we are not in a position to remove our border on the 20th of July.
Queensland has very large concerns about the state of Victoria. There have been outbreaks in hotels, schools, healthcare, retail and a distribution centre. So, due to the current community transmission levels, the border with Victoria will remain closed and will be strengthened.
The Prime Minister, to his credit, has remained consistent. He's never backed the border closures. His message on the medical advice and the economic imperatives has been consistent. But in the end, it seems he's powerless.
There will be outbreaks, there will be hotspots, and you can't just shut Australia up every time there's an outbreak. We need to ensure our economy builds back with confidence and with resilience. So I think it's important that the border's open. I've always said that.
So Victorians are being unfairly discriminated against here. Many of them, especially in regional areas, are as isolated from any outbreaks as the rest of us. And the idea that some infections in other states or testing and tracing interstate visitors are not acceptable options is beyond me. Look, like everyone, I worry about the elderly and other vulnerable people in this country, especially my loved ones. And we need to make sure we continue to protect them with special measures and proper assistance. But what's the point of keeping our infection rates so low if we still do ourselves immense self-harm economically and socially? The premiers are overreacting, they're overdoing it. They need to listen to the National Chief Medical Officer and his team. We cannot eradicate the disease. There are 10 million cases worldwide. Most countries in the world would kill for Victoria's rate of infections, let alone the rest of the country. But of course, as he has been from the start, the hardest person on Victorians has been the state's Premier Daniel Andrews, who is again locking down his citizens, this time suburb by suburb, under police patrols for a month.
We're all in this together, and this is going to be deeply disruptive for those 10 postcodes. This is going to be deeply painful and damaging for those businesses involved. This is the public health advice. this is what we must do now. If we do not do this now, then I won't be locking down 10 postcodes, I will be locking down all postcodes.
Andrews also wants to divert international flights away from Melbourne for 2 weeks so no people arrive into quarantine. So I suppose he can hardly complain about others banning Victorians. The AFL fixture now needs to be changed again. And Andrews has ordered an inquiry into infection control mistakes at their quarantine centres. The question here is sustainability. We all know we need to keep on top of this virus, but we've got to have processes that are sustainable. If you really think measures like this can last a few weeks and then life turns back to normal, then you'd back them in. But we're going to be living with this virus for many, many months, perhaps years. Are we really going to lock down states every time there's a few dozen cases, or are we going to learn to live with some level of infection, as we've been told we need to do, and then do all we can to especially isolate and protect the vulnerable? To think we could still be in this sense of panic and lockdown a year from now is really intolerable. Apart from anything else, it'll kill livelihoods.